For the next couple of minutes, I'd like to focus on some of the key and stereotype, that is characteristic experiences that people tend to have during a psilocybin journey, because there's some really interesting research on this. These are phrases that perhaps you've heard before, things like letting go, ego dissolution, feelings of connectedness. While all of that is very subjective on the one hand, those words are heard often enough and repeatedly enough in psilocybin sessions and after psilocybin sessions, along with this description of the psilocybin experience as one of the most profound of one's life, or one of the most positive, in the ideal case, of one's life, that they are worth exploring. We should also, of course, explore the so-called bad trip, the possibility that someone will have a not good time or even very frightening time while under the influence of psilocybin. So there have been some scientific studies that have explored what sorts of subjective experiences, that is, thoughts and feelings, insights that people have that relate to positive therapeutic outcomes, and more generally with the sense that the psilocybin journey was positive or maybe even tremendously positive in one's life. So while there's a century or more of writings about psychedelics that describe things like enhanced feelings of connectedness or dissolution of the ego, the loss of one's sense of self, and then the regaining of one's sense of self, and so on, there's a particular paper that describes some of those things in terms of rating scales, that is, the sorts of tests that people can take in which they answer particular questions and that link back to things like feelings of connectedness and ego dissolution, that allows us to put some numbers to those experiences and to look at some of the statistics associated with those experiences. And this is really what's important about scientific studies, whether or not a measure is subjective, so someone's self-reporting how they felt or feel, or whether or not it's a measure of blood pressure or of a chemical in the bloodstream, etc. It's the use of numbers and statistics that allows comparison between different groups and that can be compared between studies, that allows us to make some firm conclusions about what sorts of things psilocybin may or may not be doing, when it's effective or not. So the paper I'd like to highlight is entitled "Quality of Acute Psychedelic Experience Predicts Therapeutic Efficacy of Psilocybin for Treatment-Resistant Depression." I'll put a link to this paper in the show note captions. But the basic contour of this paper is that they looked at subjects that underwent two different psilocybin sessions. One at a relatively low-ish dose of 10 milligrams of psilocybin. Again, that would be equivalent to about 1 gram of psychedelic mushrooms, more or less. And a second session involving subjects taking 25 milligrams of psilocybin, or what's roughly equivalent to somebody taking 2.5 grams of psilocybin mushrooms. Those people then answered what's called the Altered States of Consciousness Questionnaire, which allowed them to address, and here I'm paraphrasing, the quality of experiences in the 25 milligram psilocybin session. So without going into too much detail, it's often the case in these sorts of two-session studies that subjects will take a slightly lower dose of psilocybin to familiarize themselves with the experience, and then the higher dose that leads to the more intense experience. Intense meaning a bigger, more intense peak, a longer session overall, greater distortions in emotionality and perceptual experience, all the stuff we talked about before. So what this study found is that one of the key features, if not the key feature, of a positive, quote unquote, psychedelic experience is this sense of oceanic boundlessness occurring at some point during the psychedelic journey. Now, oceanic boundlessness doesn't necessarily mean anything to any of us. It probably means different things to different people. It's this idea that one is experiencing something extremely unusual, even mystical, kind of beyond this world and one's normal experience, but that it's not aligned with any specific outcome in the moment. It's not directly attached to any one feeling or memory or thought process. It's this, I think it's a little bit tough to describe, because I can guarantee you I'm not on psilocybin or any psychedelics right now. And I can only imagine that you're not, although some of you might be. I can't even imagine what this podcast would be like for somebody on psilocybin at this moment. But in any case, oceanic boundlessness, a feeling of the experience being mystical and not really heading in any one particular direction, just a feeling of massive connectedness with one's environment, both in the room and session, perhaps with the guides, with oneself, with one's past, with one's present, people outside the room, with the entire world, maybe even the universe, that sort of thing. The intensity of that experience of oceanic boundlessness, the mystical experience, seems to be positively correlated with positive therapeutic outcomes, that is, relief from major depression. Now, during the psychedelic journey, as we talked about before, there are a number of steps that one typically goes through. So there's the build up to first experiencing the effects of the drug, about maybe 20 to 45 minutes into the journey or trip, then the peak. And it is during that peak that people often feel the sense of oceanic boundlessness. However, it's also often the case that it is during the peak or the maximum intensity of emotion, and we know based on direct measurements, also increases in blood pressure and heart rate, often very significant increases in anxiety and fear as well, that people will experience things like ego dissolution. And the guide's role at that point is, of course, to keep the person safe, make sure they don't run out of the room, jump out of a window, run into traffic. Sadly, these are things that have happened outside of a strong, healthy, safe set and setting. But the guide's role is to keep the person safe, but also to encourage them to let go and move through that experience, to experience the anxiety, allow it to peak, allow them to see that they're not going to die from that anxiety. They're not going to dissolve. They won't lose their sense of self completely, or they may temporarily feel as if they lose their sense of self, but then they feel it restored at various intervals during the peak or as they exit that peak and move toward the, say, second, third, fourth, fifth hour of the session. So when exactly these feelings of oceanic boundlessness and ego dissolution occur varies from person to person, but typically it's during the peak that the ego dissolution, the fear and the need to quote unquote let go is most typical. I think perhaps the best way to describe the data in this paper in a way that's meaningful to everybody is to refer you to figure 2, which if you're not looking at the paper, won't mean anything to you, but I'll describe it. And if you do want to take a look at figure 2, again, you can access the paper in the show note captions. What they did is they looked at a number of different subjective measures, things like experience of unity, the feeling that one is connected to others and to the world, things like spirituality, whether or not the whole thing felt like a spiritual experience, whether or not it was a blissful state, whether or not there were insights, whether or not somebody felt disembodied, out of body, whether or not somebody had a lot of anxiety, whether or not they had these synesthesias, these blending of visual, auditory, touch, and breathing and things of that sort. And they addressed which of those measures related to the positive clinical outcomes that were observed later after the psilocybin wore off. And while I'm not going to go point by point through each one of these measures, there's a general feature to emerge from the study, which is that the experience of unity, the sense that the psilocybin journey was spiritual, an experience of bliss at some point inside of the psilocybin journey, the sense that there were insights, that there were learnings about one's life and oneself. When those things were experienced very strongly, that correlated with the person being what was called a responder to the psilocybin treatment, meaning they got relief from their depression. Whereas people who felt less of that, okay, so the non-responders, as they're called, the people who do not benefit so much in the long run from the psilocybin treatment, tended to report less of an experience of unity, less of a spiritual experience, less of a blissful state, less insightfulness, and so on.